Good morning. Thank you for the patience with our technical difficulties. I hope everyone's rejoined us. If you attended that thought-provoking keynote address by Kathy Greenlee this morning, welcome back. If you've just joined us, welcome this morning to our first session of Age Positive 2020. I'm Teresa Bolton, a member of the Age Positive Planning Committee and the director of the beautiful Central Library in downtown Kansas City. The focus of this year's Age Positive gathering is on social isolation and loneliness, a concern for older adults at all times, and especially more of a concern in today's times. Before I introduce the presenter for this session, a couple of quick housekeeping notes. All participants will be muted during this time, and cameras may or may not be off. So you can go down to the corner of your screen. If you tap on your screen or move your mouse, you'll see the mute and the stop video icons on the bottom left-hand side, and you'll see the chat function in the middle. And if you want to use the chat function to say hello to everyone else on here or make a comment, ask.
Teresa, you're muted.
How's that now? Okay. I don't know where I got muted in the middle of that. So we're using the chat function to say hello to each other and to ask questions for Emily, and hopefully at the end we'll have time to answer the questions. A quick note, the presentation is being recorded. The PowerPoints will be made available after the conference, emailed out about a week or two. Look for those. Because Mark's Zoom is HIPAA compliant, you will not be able to cut and paste from the chat. So if there's something in the chat you want, make yourself a note on a Post-it note, or take a screenshot, or use your phone to take a picture. Any of those wonderful things. So this morning we have Emily Allen, Senior Vice President of Programs with the AARP Foundation. In her current role, Emily is responsible for overseeing the Foundation's programmatic portfolio that focuses on increasing economic opportunity and social connections for low-income older adults. Long before the pandemic, AARP began their focus on understanding social isolationism and loneliness and developing strategies to address this. Emily will share her work with us during this session. Enjoy. Thank you.
Great. Thank you so much, Teresa, and thank you, Kathy, and everybody for joining this really important conversation. I was able to sit in on Kathy Greenlee's presentation, and you know what I'm so pleased about is, gosh, and it was 2010, 2011 when AARP Foundation first started to focus on this important issue. And you know, one of the things that we really wanted to do was raise awareness about the impact of social isolation and loneliness, particularly on low-income older adults. And so the fact that we've come, you know, all the way forward to a time when we're having this type of dialogue in these, you know, very uncertain times, and really focusing the lens on the impact on older adults is gratifying for me. And you know, if there is a bright light at all on the fact that the pandemic happened, is I'm hopeful, and I think you heard that reflected a bit in Kathy's presentation this morning, is we're hopeful that in fact there will continue to be more and more focus on the needs of older adults during these times, and the fact that social isolation will continue to have a lasting impact on older adults going forward, even when we technically get back to normal. You know, we're very concerned about the fact that there were many people experiencing social isolation even prior to the pandemic, and we worry that in fact, when again things seemingly go back to normal, that in fact individuals will continue to experience that and perhaps even get further left behind. So I am so excited that you're joining this conversation. I hope to build a bit on Kathy's presentation this morning. What I want to do is kind of round out perhaps some of the information, taking a little bit of a deeper dive. I know all of you are play important roles and are important stakeholders in your communities on these issues. So whenever I speak, I always just want to make sure that you're armed with the best information possible so that as you're looking at policies or advocacy issues or programmatic work that you may want to implement, that you have the best information to make that case, that in fact this is an important issue and that we do need to address it. So I'm going to spend some time taking perhaps a bit of a deeper dive into the isolation issue, talk a little bit about the differences between isolation and loneliness, because at AARP Foundation, we're very focused on understanding the root cause of why somebody may be experiencing these issues. So in fact, we can provide the best possible solution. Unless you understand those root causes, it's difficult to really get at the heart of the matter and the reason why somebody may be experiencing these issues. And then I'm going to talk a little bit about the costs associated, again, with a lens on really making sure that you have what you need in order to go back to your communities and again, make that case. There is a cost. There's not just an individual cost to social isolation, but there's a societal cost as well. And then finally, I want to round out and talk a little bit about some of the work that AARP Foundation has implemented that perhaps you can tap into. I'm going to do a little bit of a preview, in fact, of a community workshop that we offer. We have the materials to be offered in person, but we are pivoting, obviously, and making those materials available online as well so that they can be facilitated online. So I'll do a little bit of a preview with that. So with that in mind, what I wanted to start with, again, and I appreciate that we've been using the chat to talk with each other, but I'd love to just kind of, I hope you got that second cup of coffee as there was a slight delay. But I would love to know, as you think back to, my gosh, what was it? For us, when we started working remotely, it was March 13th, I believe. And at that time, I'd love for you to, those of you that would like to put into the chat, what did you do personally to keep yourself connected when suddenly your world changed and you were suddenly not around all your colleagues and perhaps couldn't see family and friends? Why don't you throw into the chat what you did for yourself to stay socially connected with friends, with families, with colleagues, etc. So I'd love to just hear a little bit about what you've been doing as we go through this presentation. Zoom calls and FaceTimes more frequently. That's certainly one. Zoom, I love this. Yeah, all the Zoom get-togethers, lots of book clubs over Zoom, increased social media. That's great. Zoom happy hours. All right, I like that. Always good. And you see there's that thread of technology, isn't there, in a lot of our responses. And as Kathy pointed out, as we think about those who perhaps are more marginalized in community, walking the dog, I have to say that was a big one for me. But, as we think about people who are more marginalized and perhaps lower income, the digital divide is real for those individuals. And so one thing that we always like to point out is we love Zoom, we love FaceTime, we love all those things. What you realize, though, is they can't replace human connection, but they can help facilitate it or they can help enhance it, right? So unless you knew those people before, or unless you had some connection to them before, it may have been more difficult to use a Zoom or a FaceTime in order to start those connections, but they can certainly help enhance. So thanks to everybody who threw some things into the chat. And certainly, a reason why I wanted you to think back to March 13th is the fact that, now that we've come, this far in and we've been working at this for a while, people are getting more and more used to the idea that they're going to have to figure out ways in which they stay connected. And part of our role is really to help them build that confidence in order to do so. So thanks for everybody that weighed in on that. So I'm going to take a little bit of a step back and hopefully, I'm sure, many of you have been working on the isolation issue for a while. Some of you may be newer to it. So some of this may be new information, but some maybe you already know, but I just kind of wanted to go over a few things. So we know from our studies and our research that social isolation affects nearly 1 in 5 older adults. We recently, and I believe Kathy may have referenced it, commissioned a National Academy of Sciences report on social isolation, really understanding how it was impacting low-income older adults, and in particular, what roles different stakeholders play. But we know, in fact, that it continues to affect 1 in 5 older adults. And like I said before, we're concerned that these were individuals that pre-pandemic were affected. Now, how many more are affected, and how long will that last, and what are the long-term impact? So next slide, please. So a little bit about us. As I said, most of you may know about AARP, great organization. I actually sit in AARP Foundation, which is the charitable arm of the larger AARP enterprise. And our focus really is on ensuring that we are developing our vision is really a country free of poverty, where no older person feels vulnerable. And when you think about the isolation issue, there is such vulnerability attached to that issue. We really focus on building economic opportunity and social connection, and we recognize the interrelatedness of those two issues. It's very hard to get a job or access benefits or services unless you're socially connected in some way. So we really see the interchange between those two issue areas that we focus on. Next slide, please. So a little bit, I want to talk a little bit, and again, many of you may know this already, but I think it's really important to talk about isolation and loneliness as related, but actually they are also unique in many ways, and often we use them interchangeably, but I think it's really important to point out the differences, so that again, as we start to think about solutions, we are hitting the right note. So when we think about isolation, it's really those objective feelings. It's quantifiable in many ways. I'm sure there's some evaluators on the phone as well. So it's the size of your network. How many people can you count on? How many can you call if you have an emergency? The availability of transportation. I noticed during Kathy's talk, when she asked about whether you were increasing your focus or decreasing your focus on social connection and social isolation. In fact, some people said, I've actually had to decrease because of the transportation issue. We're not doing, rides to the stores or, medical transports and things like that. So we've had to figure out other ways. So isolation is really when you don't have a network to call on, you have a lack of access to resources of information, or like I said, things that are very tangible, like the availability for you to even leave your home. Loneliness, on the other hand, is subjective. So, I always use the example of you could be in a room of 100 people and still feel very lonely. You could have a large social network and still feel very lonely. So it's important to recognize the differences in those, because it's, again, we could do a lot for an individual to address the objective issues, make sure they had transportation, make sure people are calling them. But if they perceive themselves as still being lonely, then I think, that's where the challenge comes in. And I think, Kathy referenced as well, some of the mental health services and things like that are so important if people really are struggling with that perception that they remain lonely. Next slide, please. So this is where I kind of tackle a bit about, begin to get into kind of the meat of the case for addressing social isolation. So we know that isolation is an individual issue, but it's also very much a health issue. We know that research shows that the negative health effects of chronic isolation and loneliness are as bad for you as smoking 15 cigarettes a day. Now, some of you may have heard that stat before, but I always like to use it. It's a reminder that, when you think about, the dangers of smoking, cigarettes. That is something that is, shouted from the rooftops in many ways, but less is known about the negative health consequences of social isolation. And so we think it's really important to point that out. Higher blood pressure, greater risk of heart disease, susceptibility to flus and viruses, and even the early onset of dementia are all associated with being isolated and lonely. So really important that, again, as we think about linking up the health issue and the health systems with great community-based organizations like I'm sure many of you are part of, then that's where it can really be the perfect storm of coming together to address this issue. Next slide, please. So I want to talk about the costs too. Again, as part of you all building the case, it's really important to look at how many, it's literally the risk of death by as much as 45%. And older adults who describe themselves as lonely, 59% greater risk of functional decline, and again, 45% greater risk of death. That's an incredible thing, and we've heard stories. Even through the pandemic, we work very closely with some of the largest providers of affordable senior housing, and we know of stories of people, as things shut down, as resident service coordinators couldn't be on site. We know that people are struggling and in fact have passed away in their homes alone. And I think that was such a poignant statement that Kathy made earlier, is the whole idea of the fear of dying alone. And that's exactly what so many older adults are experiencing right now. Next slide, please. The cost. So this is also, again, another really important part of building the case. So we are very fortunate at AARP Foundation and AARP. We worked with our Public Policy Institute last year or a couple years ago to really understand the cost of social isolation. Is there increased cost? And what we found is among older adults, social isolation is associated with an estimated $6.7 billion, that's with a B, in additional Medicare spending annually. So, I mean, that's just an incredible amount. Again, a societal cost associated, and you see it compared here with other issues that are kind of more top of mind. Heart disease, arthritis, diabetes, and high blood pressure. It's right up there with some of those that we naturally think about treating every day, right? And so again, as we think about the connection between the healthcare space and strengthening the ties with community-based organizations, there is a cost associated with not acting, and that's really the point we want to get across. Next slide, please. So the risk factors, and you heard a little bit from Kathy earlier about some of these as well, but we always think, well, we want to dig into the risk factors because again, unless we understand what the root of the problem is, it's very difficult for us to address those problems. So at a societal or community level, limited and unaffordable transportation, that comes up over and over again. It's a tough nut to crack, we know, but that is one of those things that really causes people to remain in social isolation. Rural, unsafe, or inaccessible neighborhoods. Being in a rural environment is tough, and I'm sure many of you all come from those communities that it's just a long way to go before you can access services. And then certainly societal barriers, ageism, Kathy touched on that a little bit, and other forms of discrimination. We know that populations that were already marginalized in society, so with race or ethnicity, LGBTQ communities, those that were already marginalized experience higher rates of social isolation and loneliness as they age. Next slide, please. And then at an individual level, we look at some of the risk factors. So being low income is actually a risk factor. It's not a one-to-one. So we did a research project looking at isolation and loneliness with the University of Chicago, and there is a correlation between having low income and being more at risk of social isolation. Doesn't mean that because you are low income that you would be isolated, but there is higher risk, and that can be from a variety of things. It could be lack of access to technology, or not being able to travel, or perhaps not having a job. And that kind of fits into the retirement piece as well. When we look forward to retirement, but when you think about it, think about who your network is. Think about all those colleagues that you lose as a result of retiring, and how do you think about replacing that network? Being a caregiver is certainly, you are at risk of being isolated. You're so focused on the person that you're caring for that you begin to step away from things that may have allowed you to be more socially connected. Chronic health conditions, Kathy touched on hearing and vision loss, limited mobility, living alone, loss of memory, or loss of a spouse. Somebody may have been going along very, very well, and then all of a sudden the loss of a spouse or a partner long-term partner, has caused them to completely change how their life looks on a day-to-day basis. And that can certainly cause an uptick in social isolation. Next slide. So I want to talk just a little bit, and then we'll have plenty of time for questions as well. I want to talk just a little bit about some of the resources that AARP Foundation has. So I believe it was in 2016, again, recognizing that we really wanted to raise awareness of social isolation as a public health concern. We implemented a platform, a web-based platform called connecttoeffect.org. We partnered with the National Association of Area Agencies on Aging. Sandy Markwood is on our executive council. And then United Health and Gerontological Society, and really came together to understand how could we offer tools and resources to really help raise awareness about isolation, and use it also as a platform to help individuals who may be feeling lonely or disconnected understand practical ways in which to reconnect with their community. There's so many great resources out there, and I'm sure your organizations have so many of them. Part of the problem is, how do we make sure people are aware of them and can access them? So as we think about the goals of Connect to Effect, it really is to increase social connection by addressing those root causes through this consumer portal that curates evidence-based content and activities. We decided, when we began to look at solutions, developing solutions that would address social isolation, that we would focus on the Duke Social Support Index as our measurement tool. So we always have to have a measurement tool and to make sure that our solutions are hitting the mark. And so we built an assessment, and I'll show a screenshot in a moment of Connect to Effect. But we built an assessment that people can come on, understanding why they may be experiencing social isolation or loneliness, and then link them to evidence-based solutions that could in fact help them. And these come from various places. In some cases, we've provided grants to organizations who help further the evidence that their solutions may be working, and then we can offer those up to individuals. And then, like I said, really based on those individual needs and interests and abilities. And we continue to create more a center of excellence and clearinghouse of best practices and, again, evidence-based solutions to address social isolation. We have focused probably more on the social isolation side of things versus the loneliness side of things. But again, in some cases, not in all cases, but in some cases, a solution may hit the mark in both places. So next slide, please. So here's a screenshot of our connecttoeffect.org website. As you can see, we've got some statistics, and then we've got a lot of great content. We've updated it more recently with COVID-related tips and content. But we always, our call to action is always go on and assess how social isolation may be impacting you or may be impacting someone you love. So the assessment you can take for yourself, or you can take it for a friend or family member, just so that you have a better understanding. And it takes you through a process of, thinking through, like, what's the size of your network? How many people have you talked to this week? It really breaks it down into understanding why you may be experiencing that. And then again, links you with curated content that helps you understand how you might address what programs, what technologies, what solutions may be most effective for you. Next slide, please. So here's what I wanted to talk. I'm excited about this. This is our community workshop, and I wanted to give you just a quick preview. And I've talked a little bit with Kathy that for those of you who may be interested in learning more or getting more than just a preview of our community workshops, then we'd be happy. We'll make sure that we get your names and contact information so that we can hook you and your organizations up with the content that we have on this. So again, when we first started to design this, we wanted to create some content, a facilitator guide and a workbook that would really help bring Connect to Effect and the issue of isolation to individuals in communities. So we've had libraries work on this. We've had some AAAs implement this. And it's really all about engaging individuals to, one, understand the isolation issue better, And then two, begin to develop the skills and confidence that they need in order to address those levels of isolation. So we're really excited. There's a great facilitator's guide. There's a great workbook. And one of the things, I'm actually going to have you all do this now too. So one of the things, again, we start in the workshop by just explaining the issue of isolation so that we kind of demystify it a bit. But one of the things that we learn, we think about behavior change. When you think about behavior change, it's usually about eating better or exercising more or things like that. What we realize is that even with social isolation, even with helping people address their level of social isolation, that there's a behavior change that actually needs to occur as well in this space. So, and a lot of it has to do with confidence. And again, when you think about the other things that you may want to change about yourself, you have to build the confidence that you can run a 5K or that you can cook better, more healthy meals, right? That seems pretty natural. We don't think about that as much when we think about social isolation. But the fact is that people have to begin to build confidence in their ability to connect back in, whether it's fear of rejection or, discomfort with making new friends and things like that. So this is a part of what the workshops helps do. So I'm going to take you through a little mini exercise here. We have something that's part of the community workshop that's called Developing a Friendventory. I love that title. I didn't make that up, so I'm taking no credit. But the Friendventory, what it helps you do is understand who's in your network. You may not have thought about that very much. So I'm going to do a very rudimentary, I feel like I forget when it was, the elections or whatever, but what I want you to do, if you have a piece of paper down, just draw, if you can see this, I'm not sure, there we go. Yeah, draw 3, what do we call that? Concentric, is that concentric? Circles. Draw a small circle and then a circle around that and a circle around that. So this is what we ask people to do in the workshops. I know that's really low tech there, but I didn't include it in one of the slides. And what we ask them to do is think about that middle circle. Who might be closest to you? And when I think about it, I think, like, oh my gosh, I wake up in the middle of the night and something's happened. Who do I call? Who's that person I can call? And probably everybody on the phone today can pretty quickly think about a next door neighbor, a friend, a best friend, a family member, a sibling, whatever the case may be, who would fit squarely in that middle circle there. Boy, these are people that, I know I have people that, I have a dog and I was running late or that my flight was canceled. And it's like, boy, I could quickly text somebody and say, my neighbor and say, oh, are you home? Can you go feed the dog? That's the kind of person that's really in that inner circle. They will likely drop anything to help you. So think about maybe a couple people that would really be in that middle circle. Now go out one rung more. And think, well, I've got some other friends. I don't know that I would necessarily, wake them up at, 1 o'clock in the morning to help, but, I socialize with them, or I know that they would be happy to, get my mail in or something like that. So, write down a couple names there. And then as we think about that larger circle, who are kind of on the outskirts? Those individuals, you're not super close to them. Again, could be a neighbor that you wave to, but you don't really, socialize with them or interact with them too much. It may be a colleague that you don't, again, but you don't, you have a little bit in common. You work in the same place, but you don't know them really well. And what we do with this in this conversation is, one, it helps people take that inventory, doesn't it? And what we find with people who are really socially isolated, it's very difficult for them to identify anybody to put in that center circle, that middle circle of those closest to us. And so that what we really ask them to do then is develop a plan. So if they have nobody in the center circle and everybody's more on the outskirts, we ask them to develop a plan for what can you do to begin to move those individuals from the outskirts in, and how do you develop those relationships and those connections. And so much of it is about building confidence of those individuals to, one, take the initiative to reach out to those individuals. Think about what they may say. even practice narrative of what you may say. I mean, now with COVID and social distancing, might there be an opportunity for, you to reach out to a neighbor and say, hey, would you like to take a walk? We can stay 6 feet apart, but would you like to take a walk? And I know it's really hard, particularly for older adults. I mean, when we're kids, it's easy to make friends. Y'all hang out on the playground. I couldn't think of the word playground. You hang out on the playground, or you're in school. You've got those natural ways in which to interact with people. But as an older adult, it's very difficult to do that. And so part of what we do is go through the process of helping them plan, how do we bring more people into those inner circles that really can be part of your network, and people that you can interact with more frequently. So that's just an exercise that I wanted to share with you. Again, very, very low tech there, but I thought it was important. And this is just an example of some of the things that you would find in the community workshops. So next slide, please. So AARP Foundation Connected Communities. Let me talk a little bit about that, because I don't know where everybody is coming from or what organizations you work with. But as I said earlier, we work with some of the largest providers of affordable senior housing. And about 3 years ago, we began to realize that there was an opportunity to think about how we use voice-first technology as a way in which to increase connections for residents of affordable senior housing communities and the community. And so we begin to test out, one, would an older adult even want to interact with something like an Alexa or a Google Home? What if they did, would they continue with that? So we just wanted to, it had nothing to do with social isolation. We just wanted to better understand whether or not this would be accepted into their lives. And so when we answered that question, the answer was yes. It was really interesting. We gave them Alexas, and we didn't put any parameters around how they would use it. And many of them found it, again, not as a replacement for technology, but as a way to, engage back in their community. So they would, good examples are they would, listen to music together. I mean, here was this easy way to listen to music. They do trivia together. They'd sit together and do trivia. And then there's some very poignant stories, as you might imagine, of individuals who had not spoken with anybody. And, we'd get the feedback that the Alexa voice was the first voice that they'd heard in a week. And so again, not trying to have technology replace human connection, but figuring out ways in which it can facilitate those connections back to individuals and resources. There's one story, and I'll try to get through it and not cry, but we had one gentleman who was one of our early adopters, and he had learning difficulties and it was illiterate, was unable to write. And so he utilized his Alexa, and it was the first time that he'd been able to write a birthday card to, sorry, I'm going to get all cracked up, been able to write a birthday card to his grandchild. And so there's just ways in which, we wanted to explore how some of these new technologies could, in fact, really support the needs of older adults. So as you see here, we've been working with providers of affordable senior housing to really equip their residents and their staff with these types of tools that we need to take advantage of. And so it enables things like access to community information by just using their voice. So it gets over the hurdle of, oh my gosh, I can't use computers. I'm afraid of using even things like Zoom or FaceTime. And so just with something that they use every day of their voice, they can access community information. We make it easier for them to sign up for things that may be happening in community. And now, even during the pandemic, when so many services have been shut down, we've been using it as a way to broadcast out information from the community and from the resident services coordinator to make sure that everybody is informed of what's happening. And that it's been a really interesting, we're pivoting now to look at how do we do this directly to consumers. And how do we think about social connection as not an end, but a means to an end? So when we think about social connection, it's not just about reducing the level of social isolation, although that's very important. But we want to make sure that we're connecting people back to the services and resources that they need in order to thrive, and be able to age in their homes as long as they so choose. Next slide, please. So our chat bot, this is an interesting one too as we think about older adults, but we found it to be really amazingly successful. We launched our chat bot off of our Connect to Effect website, did a lot of testing, but this is really focused on helping older adults have, again, another way to connect back into the community. So what we found is that most older adults, or many older adults, have a smartphone or have a way to text. And so we began to test the use of a chatbot, and we're very upfront. We tell them right up front that this is not a human on the other side, but it gives them a way to have a back and forth dialogue, and again, kind of open up about what they may be experiencing. And then our responses are scripted very specifically back to them based on what they have told us. So, if it's about, we've even talked, to individuals who may be experiencing food insecurity, they're alone, they're isolated. And so our resources back to them may be resources related to how they connect back to food. But it also then plays off of some of the other resources and solutions that we have on Connect to Effect. So, this is still kind of in the testing phase. It's very new, but just since March when we launched, we've engaged about 60,000 people using the chatbot. And we are actually, what we're pleased about too, is that, again, we embed evaluation in everything that we do. And so we actually ask the Duke Social Support Index questions at the beginning. And so we have a measurement of their level at the beginning. And then what we'll do is we follow up 6 months after. And so actually just started this month for our first 6-month follow-up of those who engaged earlier this year. And so we'll be able to really see how well something like a chatbot is helping people connect back into their communities. So again, another interesting new technology that we're trying to really figure out, how do we make it useful and applicable to what older adults may be experiencing. Next slide. And that actually brings me to the conclusion of my slides, but I'd love to have any questions or have any thoughts on how you or your organizations may be implementing things like I've talked about, or how you may want to engage with AARP Foundation. Can I demo the chatbot? Actually, I can't here, but if you go to connecttoeffect.org, then it's actually there's a demo associated with that right on connecttoeffect.org. So we want to make it, try to be as early or as easy as possible for people to access the information. It's not really too early to let people know it is live, and so we can send out kind of a very direct link, but it's really, it's kind of it's really quite engaging. I've even used it, again, as part of testing it out. But it's amazing what we're excited about too. It's not a one and done. That's what we're pleased about too. We try as much as possible to make any of our solutions as sticky as possible. And by that, I mean, we don't want it to just be somebody comes on, uses it for a couple minutes and off they go. But actually what we've seen is the return of people to use it again is actually, we're really pleased with that retention rate. Is Alexa only a two-way communication? I think for the most part, what I find interesting is how some of the residents in the senior housing used to use it, is they would, instead of it just sitting in their apartment, they would take it to a community room and, like I said, do trivia contests and things like that. So in that way, it was a social engagement, again, a facilitation for social engagement versus just a back and forth with an individual. How can we connect a senior housing building with Connect to Effect or connected communities? Great question. Again, going on connecttoeffect.org. I know Kathy was going to collect some of the, if people are really interested, I can get you connected with our Connected Communities team, and they can do demos and things like that for you on those and how we get them set up. Can I receive the community workshop information? Absolutely. Well, actually, the way that we were going to do it this way, it's not, all the materials are not up yet on Connect to Effect. We've just pivoted them to be in a more virtual environment. And so I want to make sure that we get your names and contact information. I don't know, Kathy, if you want to add anything to that around collecting, so that we then get it back. And then Kathy and I have already talked about perhaps separately in a few weeks or a month or so, doing another session where we take a deeper dive in kind of a train the trainer model for the community workshops. And we'd be happy to do that for you all. And there's no cost associated with it. Now, it depends on what you mean. So with connected communities, while we have provided in some cases the Alexas, the expectation is that we're not really in the deployment of technology business, but for the technical support, and my team offers technical supports and guidance and getting things set up, and how to implement and facilitator training and all of that kind of stuff. And that's just something that we do as part of our goal of getting this in as many hands as possible. Chatbot sounds more user-friendly for older adults. Yeah, you're right. That's definitely some of the things that we've experienced. The other thing that we can do with chatbot is actually really understand, that we're learning a lot more about what people are experiencing, how they're experiencing, and perhaps what actions they're taking. And that's one thing that's really exciting for us. And yeah, you're right. I mean, what we found is, and there's lots in the field around SMS and text services to remind people, doing nudges and reminders. And we found that older adults are pretty used to that versus, having to have other types of technology, having to go on, a Facebook or a Zoom or things like that. Oh, what is the best computer, tablet, grandpad that is user-friendly for someone new? Yeah, that's a tough one for me. That's probably beyond my expertise. I think one thing that we've done with some of our, whether it's a Chromebook or something like that, it's just not to have all the noise on, a tablet or whatever, meaning so many different options. It's really, if particularly for an older adult, if it's pretty streamlined of why they may be using it, and then apps and all the other things that may be on there are just kind of not are taken off or whatever, so that's very streamlined. Let's see, what other languages. Thanks for the question. We are pivoting and putting it into Spanish as well as our Connect to Effect. We will have a Spanish version, I believe, later this year. Oh yeah, Kathy's saying the participant evaluation will receive following this session will offer you and your organization the opportunity to indicate if you're interested in learning more about AARP Foundation's community workshop. Perfect, thank you. I forgot that's how we were gonna do it. But yeah, that'll be great. If you want to indicate that, we want to get it out there. It's a great session. Like I said, we tested it with actually a health system, and then a collaboration with a library system and a AAA, and really got great positive feedback. Now, what's interesting is, and I think this is one thing we always have to think about, individuals who are socially isolated are likely not going to be the first ones in line to attend a social event, Now, maybe online will be a little bit better. The other thing is also what we're learning around the marketing of products and services and programs as it relates to social isolation, because very few people want to raise their hand and say, boy, am I socially isolated, I could use help. So we've thought a lot about, the community workshops and things like that on how do you market this? How do you get people involved who may be socially isolated and reluctant to attend anything like this? And so a lot of times we may talk to them about somebody they know. Somebody you know may be isolated, somebody in your family. Come learn more about how you may help them. And the reality is they can really use the information themselves. With chatbot, we call it a support chatbot, not a chatbot for isolation or anything like that. It's really about using the descriptors and not saying the isolation chatbot, but it's really about thinking about it as a support and a connection back. We also purposely named Connect to Effect as a way, not thinking about individuals who are isolated as only the beneficiaries of service, but actually as they become more engaged, they have something to offer too. We had, Kathy Greenlee earlier referenced kind of telephone reassurance lines. We've seen a lot of those and have supported some related to using volunteers. What we found is that an individual who may want to be called or may be called as a result of them experiencing social isolation, once they get that connection, they actually want to become a volunteer themselves. They want to start to reach out to others because they see the value in making those important connections. So it's just a good way to be a reminder that the people who are isolated have so much to offer and so much to give that we've got to figure out a way to get them connected back, and they can often be your biggest advocates then. Oh, let's see, Carmela says she can display the demo of the chat bot if you would like. Is there time? Probably not, because I didn't have it teed up. But like I said, what we can do is, if those of you that are interested in the community workshops, we can add that in as part of that, because I think that can be an important part of a resource for individuals. So we can certainly make a demo available as part of the community workshop. So as Kathy said, when you get the evaluation, just make a note that you or your organization is interested in learning more, and then we can make sure that that's available to you. So somebody said not clear if the user has to pay for Alexa. So in some cases with the senior housing providers, they will actually build into the budget because they see the value of that connection back. They'll build into the budget actually supplying the Alexas. So it works different and depending on the different cases. So are there partnerships with Apple, Google to either tailor their technology for older adults? Yeah, SNL's Alexa Silver. Yeah, I remember that one. That was right. That came out right. You have to understand, my poor team, that came out like right when we were launching. And boy, they were, it was funny, but that, that's a good question. We have had quite a bit of conversation with Apple and Google, particularly as we think about how do we provide relevant tools and resources. I don't know that they're there to completely adaptable or solely for older adults, but certainly the conversations continue. So any other questions? I hope I didn't miss any, but I've promised Kathy that if questions come in, then I'm happy to continue to answer them even post this session.
I think I did see one other question. Is there a particular piece of technology or brand or something that you recommend that's user-friendly?
That's a good question. I mean, like I said, so for example, AARP Foundation runs, many of you may be familiar, a large tax aid program where we have 35,000 volunteers supporting taxpayers now in new and different ways. One thing that we noticed about, there's an ease of use around Chromebooks. Tablets, yes, certainly, but when you think about Chromebooks is kind of streamlined and pretty easy to use as we thought about our older adult volunteers. And we're kind of looking at that too. We also run Experience Core, which is a program that pairs older adult volunteers with schools and after school programs to really look at how do we help students get on grade level reading by 3rd grade. And so now again, we're pivoting to a virtual environment. And so we're looking at things like Chromebooks. They're fairly affordable and pretty streamlined as you think about the content that you can provide on them. So again, not an endorsement, but that's what we have used, particularly for our older adult volunteers.
Also, the question about connectivity. So do we find that people have access to the internet that need this? Do you do any hotspots or recommend anything like that?
Yeah, really good question. You know, we're really focused now. As I said, we work with some of the largest providers of affordable senior housing. We've got a group that we've formed that includes Leading Age and some other groups that are really looking at the issue of access to broadband. And it is a problem, not going to deny it. It is a problem because many of the housing facilities are not retrofitted with broadband. So again, as we think about kind of an advocacy, Ben, you know, the idea that access to the internet, it needs to be almost a basic human right, and make sure that there's dollars available for ensuring that particularly senior housing, we've certainly seen that through the pandemic, are outfitted. But yes, you know, to get around that, in some cases we've used hotspots. In some cases, we've tried to broker relationships between internet providers. So whether that's T-Mobile or Consumer Cellular or whatever, and broker relationships between those housing providers so that it can be at low or no cost.
Have you seen any change recently now with all the school kids? Some of the programs that were providing connectivity for older adults and devices for older adults have pivoted to school children now.
Very true.
Is there a way you suggest we advocate to make sure that our older adults are being taken care of as well?
Yeah, no, that's such an important, and we never want to pit, you know, one generation against another, but we've certainly seen that. So, you know, as an example, you know, I mentioned Chromebooks. Right now, particularly as schools have needed to provide technology to their students, there's a real void of availability of Chromebooks right now. And so even as we think about, so yeah, absolutely. I mean, I think making sure that states are age friendly and communities are age friendly, and that includes, in fact, access to technologies. And again, that's part of kind of why I think, you know, building the case of the healthcare costs, the individual costs, the societal costs are so critically important, because it's not just about, oh, you know, the poor older person that just hasn't talked to anybody. There is a devastating health consequence and emotional and physical and mental well-being costs associated with this. So that's part of kind of making that case.
I think you actually just answered the last question we had without being asked it directly. If anyone else has a question, I know that you are going to get the information about the program itself in the follow-up email. There is a survey that everyone gets after the session, and I'll give everyone another minute or two to ask anything else. But while we're doing that, I want to thank Emily very much for this morning's information, and tell everyone that tomorrow at 9 o'clock promptly, hopefully promptly, we'll be addressing loneliness and social isolation through a circle of friends tomorrow at 9 o'clock. And I'll see if anyone else has a question. I'll go ahead and ask a question, a personal question. This seems like it takes a little bit of part on the older adult to engage. My mother feels like she doesn't need any friends, right? That she's perfectly fine in her own little bubble. Clearly she's not looking in that situation. How do you engage the reluctant person?
That's a really, really good question. And usually as part of, you know, my beginning, you know, there are people that you know, the reality is that they are okay. And in some cases that could be very true. People may be fine kind of being in their own bubble. I think part of it is that, you know, for those individuals that are very isolated but reluctant to re-engage, I think, you know, part of it is pointing out to them as well that this, you may not realize it, but it is having a health consequence. You know, it is having an impact. And when you think about, you know, longer term, you know, it could mean early onset of dementia. It could mean, you know, and pointing some of these things out. And then again, not just pointing out you need to be more connected, but then helping them think about ways that they could become more connected. You know, again, and for some people, it may not be, you may not need 10 friends in your inner circle, but you need that 1 or 2 contact a week, you know? And so I think just helping them understand where they're at and how might they move that one, you know, instead of not talking to anybody, who's one friend you could talk to, you know, each week, you know, start with the smaller steps and then let it grow from there. But I think expecting somebody to kind of fully re-engage back into a network may be too high of an expectation, but pointing out ways in which they could take small steps, you know, so for your mom, you know, maybe it's, well, mom, I know, but, you know, it's really important that, you know, and I think the other part of it is making sure that they know that they're valued and what they could pass along to somebody else is as important as what they could get from that person. So, you know, I think sometimes reversing it and saying, well, you know, remember, you know, our former neighbors or whatever, I heard that Mrs. Smith is really lonely, and you know Mrs. Smith, it could really help her if you called her. You know, kind of trying to turn it on its head a little bit and not always have the person who may be experiencing isolation feel like they're being a burden, but actually they're being a help. And so that may be one way to get them to look at it a little bit differently.
That's great. And we did get one new question. I actually just had this question yesterday from a colleague. You get some people put together an email or you know, a Facebook blast or something like that about programming. Where are good places to post that? And if you're trying to engage people that are on the other side of the digital divide, what print things can we still do to get people to tune in?
Sure. Now, really good question. You know, I think, you know, that one, going where they are naturally going. Now, again, this is kind of a challenging time because not many people are going many places. One thing that we've tried to do, and it kind of hits on an earlier question about the medical community, building on our National Academy's consensus study, we know that the health system is one system in which often that's kind of the only system that older adults may be attached to in any way. They're not in schools, they may not be taking part in senior center activities or things like that, but they're often tied to a health system, a doctor or clinician. We can't expect clinicians to address everything, but what we're trying to do, and this kind of answers how is the medical community addressing this, we are trying to increase the knowledge base, the awareness, and then the effort to do some screening for social isolation as they are screening for other social determinants. But we know that clinicians don't want to screen for something they can't treat. And so there again, we're using the recommendations from the NAS study to begin to look at how do we strengthen the ties between clinicians and health systems and community-based organizations that do in fact have the programming and services that could be helpful. So we're testing some things out. We're working with federally qualified health clinics to understand how do we educate medical staff and clinicians on the issue of social isolation. How do we, you know, what's a reasonable level of screening they could do? And then how do we think about whether it's through, you know, aggregators of resources, how do we make sure that we can close that loop between the health system and community-based organizations so that we can treat those that screen for being socially isolated? So I hope that helps a bit.
Absolutely. Just, let's see, our community is doing cable programs targeted to older adults, facilitated speakers panels, even entertainment.
I'm sure they probably are, but I'm not, nothing's coming top of mind, but you guys are probably the experts on that. I loved some of the earlier things around, you know, the drive-through barbecues and the drive-in concerts and things like that. I thought that was great. I mean, there's so much innovation happening, particularly right now at the community level, that it's through venues like this and sharing that I think are so important.
I think we've answered all the questions, and I know that people are going to come up with a question as soon as we
I'm
get
sure.
off, so. Okay.
Right.
Can you share screening survey questions you used to see range? I'm not sure I understand that question.
Yeah, no, good question. So actually, if you go to, and I know I keep referring back to Connect to Effect, but the assessment that we have on there is actually the basis for, so it's, for example, it's, again, like I said, it's, you know, over the past week, how many people have you spoken to? Over the past week, how many social events, and we made it relevant for COVID times, either online or in person, have you attended? So it's those kind of things that are helpful in understanding, you know, are people connecting? What's not only the size of their network, but the quality of the interaction. If you have one good conversation that you feel like you've been heard and listened to a week, that can be better than having 10 that didn't do anything for you at all. So a lot of it is just kind of understanding the size and the quality, or the amount and the quality of those interactions. Do you feel like you're, you know, when you've talked with family or friends, do you feel like they understand you? Those kind of things. And the screenings are available on connecttoeffect.org. That's connect with the number 2 and then effect with an A .org. And so that if you take the assessment, then you'll get a sense of those screening questions. Great. Well, I don't see any more coming in. So again, thank you all so much. I'm just thrilled to be part of this dialogue and so appreciate Kathy and the Mid-America Regional Council inviting me to participate, and look forward to lots of follow-up conversations.
Everyone look for that, the participation evaluation following the session, and make sure you fill that out. And we hope to see everyone tomorrow morning.
Thank you.
I'd also like to add in that I will be sending out another reminder confirmation that will contain the links for tomorrow's sessions. If you do not receive that, please reach out to me via email at canderson@mark.org.
Thank you, Emily.
Thank you.